Welcome everyone. We will be waiting for 5 minutes, then we will start inshallah. السلام
بسم
عليكم.
الله الرحمن الرحيم. السلام ورحمة الله وبركاته.
مساكم الله بالخير جميعا. حياكم الله. Good evening everyone and welcome to today's webinar. We are pleased to have you with us in this session titled Autonomous Health Hajj Health PMO AI Governance System for Healthcare, where we will explore how AI can support governance, enhance coordination, and enable real-time decision making in large-scale healthcare programs. It's my pleasure to introduce our speaker, Dr. Jehad Alamri. Dr. Jehad is Associated Professor at Taif University, holding a PhD from UK. He brings extensive experience in cybersecurity, IT project management, and digital transformation, and has held several leadership roles, including Dean of Facility of Computers and Information Technology. Please join me in welcoming Dr. Jehad.
Hello, everybody. Good evening, everyone, and welcome to the webinar. I'm really pleased to be with you today as part of AI Project Management Hackathon. In this session, we will explore a very high relevant challenge in Hajj, which is how to improve governance and compliance in healthcare project during Hajj using artificial intelligence. This is the beginning. This is the initiating of my teamwork that will focus on some coming practical sessions to help to understand the problem, shape the solution, and prepare to build it in phases. Just to put you in a context, Hajj is one of the largest recurrent mass gathering in the world, with 1 million of pilgrims in a very short time windows. So this is make health operation not only large scale, but also high time sensitive and risk intensive. So we need to look at number of issues that managing project in Hajj, particularly in health sector. So let's see now during this webinar, we will look at what happened in Hajj, especially in healthcare operation, which is not just it's not just complex. It's a real time sensitive and high risk project. So why? Because there's a multiple stakeholders, limited time windows, and also there's a large scale of organization creating significant governance challenges. And we know from the recent years that governance, compliance, and governance become more important in project management, and it's shifting the focus from the services to the value. So we need to look at how we can produce value, not the services or the product. So this is why we looking always now, our focus shifting now to compliance and governance. So what happened? What is the problem? The main problem is that there is a delay in setting up temporary clinics sometimes, and also there's a missing of approval for readiness, and also there's a gap in incident reporting. These three things, and it's been reported that the most important problems face the health industry or the health operations in Hajj. All the team are really high qualified. They have all the knowledge and skills and how to manage this kind of the project in a very short time, and sensitive and sensitive and short time, and also with a different number of the different a big number of peoples with a different number of nationality, languages, and habits. ages, gender, all kind of variety that could increase the need for quick response in terms of health problems. So this is not administrative issues. It is directly impact the response time and patient safety. So it is not uh, some luxury or some high managerial satisfaction we would like to reach. No, it's really a safety matter, and it deal with very sensitive and delicate health issues that could affect people's lives during Hajj. So how we can solve this? We try to explore how AI can enable continuous monitoring. We need monitoring in a continuous manner. We need to reduce the risk by detecting all the risk earlier as possible, or even predict it if it is possible, and also have a real-time decision support in this complex health environment. So we need to first to understand what to build to help the health industry in Hajj, to governance and monitoring all the actions during Hajj, detect the risk early and support the decision taking. And also we need to understand how what is the problem and how we approach this problem, and finally how to deliver a focused AI solution during the hackathon, and therefore to apply it in real time in Hajj. So this is our agenda. We will spend the next half an hour or so by introducing the background problem, and also later we will go deep in the problem to understand it and understand why it affects us, and then propose the artificial intelligence solution vision, and then what we expected as a team, what we be expected to do as a team in this hackathon, and we will conclude by opening for questions and answers. So let's start by defining the problem. So what the core question is, what is the challenge here? What is the motivation for us to look for this problem? So the challenge here is that health governance during Hajj is not just a complex, it's a mission critical that we deal with a multiple initiatives such as temporary hospitals. We need to have temporary hospitals where it applied. We need to have a mobile clinics as we go. Also we need to have emergency response system for all kind of emergency, health emergency, and God forbid, and if any problems happen during Hajj. Mostly it's related to heat and some infections, quick infections, and also with age problems for some pilgrims, and also to monitoring all the public health to control the infection and other kind of problem that could be a health problem that could be spread during Hajj. So to do all of these and control all of these risk associated issues, we need to have a really established governance. The problem with the governance here is that all the report, all the information is come as a fragment. It's not in one coherent source, from one coherent source. It's come from different places, from health ministry, health system. It come from all the housing and transportation and all kind of services that help pilgrims during Hajj. So it's fragments first, and it's mostly manual. It's been developed and well established, but it's still manuals, even if it is using digital forms, but still need to be entered by the stakeholders, by people, and also need to be read by people. So that's one of the problems, is that it's become like a manual way of governance. And also, it is not synchronized. It's not in real time. It happens like a few minutes ago, maybe a few hours, and by the time it's reached to the decision makers, it could be too late at that time. So that will and this situation will it's matter for us because it delayed the detection of compliance issues, and also the consequently it will impact patient safety, emergency readinesses, and operation performances. It's insufficient governance that increase risk exposure and reduce decision effectiveness. Okay, so where it does happen, this challenge exists across health project environment, including project management offices, field operations, emergency services, and digital record. All that kind of system affected by this problem. So what we need. We need to use real examples. Now we go into we're using real examples to see why where the delay happened in reporting and missing approval and lack of coordination, and see how we can solve this problem using AI by integrating all the data together and read it in artificial intelligence manner. So let's see the current situation from the publication, from the report about health issues happen during Hajj. There's a governance, all the governance based on monument reported. This is a fact. This is what's happening, and it's used periodical reviews. It has a limited real-time visibility across health projects. It needs people. It needs the expert people who really sense the problem and try to interfere and put their experience working in Hajj environment for like 20, 25 years or 30 years and take the decision by themselves. But what we needed to guide them, to help them with the real data, real-time data, and complete detection of the problems. As I said, all of them is fragments across the multiple system, which is fine. We couldn't have one complete system. It's not practical. It's come from different system, but we need to integrate the system in a monitoring way that read the data and predict what could happen and also support the decision there. So issues always detected during auditing or review, which is always almost always like too late for correction and changing. So what we need here, the desired AI solutions, it's that we have AI enable transformation to enable the governance, compliance and governance in an automated way. So we have a continuous AI-driven monitoring of health projects that read all the data from different places and present it in a readable and correlated way. We have a real time dashboard for governance and compliance where we can detect and follow all the decisions and decision points that we needed. So we can see that this is the problem, this is what we need to do, and this is the person who need to take the decision with all this information, so we can take the decision in a timely manner. And also, it could help also, as we're going to see in next slides, early detection of risk and operations issues. That's really good because most of the issues have their signs come earlier, that experts can read it, but we don't have any experts, and all the experts will be under pressure at that time. So we need it to be automated, presented in a right way. Also, we need to integrate all the data across the stakeholders for better decisions. So even if the health a decision doesn't come from a health employee, maybe we need some people from different services like transportation, security, and all kind of things that we need that we need help from them. So the gap here is not technology; it's the absent of the continuous governance. If we put this as a motto for ourselves, we are not keen in AI or in technology. We are keen on providing continuous governance, whatever way we can do it. And the best way to do it is we're using AI and particular technology. So how will AI will be applied here? So to look at AI and how it fit into this, we are not building, as I said, complex AI for the sake of complexity. We are building a governance intelligent layers. So we are not building everything. No, we taking we go at the end of the information chain, and we build a governance and intelligent layer. In here, all the data integrated in this system, and you can apply different AI technology as I'm going to explain. So we need to collect data from multiple sources, analyze in continuous manner, provide actionable insight. There's always expert output come from all this data. So we need all the data available in real time. We need to analysis and continuously, and also we need to have insightful action plan for all the problems. So how we can do this? We can do it by have all this data, continuous analysis, and use different AI tools like prediction analytics, particularly to detect delay and risk. So it, as I said, it read all the signs and do all the correlation and classification that help them. They help all the people using the system to detect the risk in early as possible. They have a massive data from all the last 10 or 20 or even 40 or 50 years, and they can use that. The last 2 years only, and with the current year, and they can predict as much as almost most of the risk that could happen, and it could be prevented, but sometimes because of missing signs, it prevented, or the start of preventing or stopping it come sometimes late. And also we need to have a rule-based engine, uh, especially to have the actionable insights. So that would help compliance checks. So we don't need to use expert here. We can use AI to check all the compliance checklist. We need to use also the natural language processing, NLP, to analyze, report, and unstructured data, because we will have all the time unstructured data that come from report and from notes. So we need NLP to read it, classify it, and bring some insightful. So what is our power here? How we can use the AI power? We use two different. We have three different important elements of the data that we need to look at it. First, we need to look at the data types. We will have structured data. That's easy, like schedules, KPIs, risk logs, all of that kind of things that it's already in the system, in a table, in tables, and in classified manner. And also we need a semi-structured data like incident report and checklist, which could be filled by people who on the field at the time, so they can but check on some report, and also they can add some notes in there. And also we need to look at the unstructured data, like the notes field, and also auditing report from previous Hajj time, and also from live reporting. The data should come from, this is the second one, the data sources from Ministry of Health systems. So we need cooperating between all these kind of services and ministry that helping or producing the data. So we need Ministry of Health system, Hajj Health Care Operation Platform. We need Project Management Office reports and dashboard, and also from Emergency Response and Monitoring System. So that's an issue of security as well. So we need to look at how we can integrate this data without compromising security and safety for the data itself. In the hackathon, in our project, so we're going to look at the simulated data set that could be provided by from previous Hajj times, and so we can use it and request it and use it at that time. We can have a sample report and compliance template. We need it so we can build the compliance monitoring system on that. And also we need to have integration of all this data in one layer. That's also a challenge that we need to look at it and make sure that it can be possible. And also we need to focus on validation, not full production data. We couldn't have all the data in the hackathon, and even later if it's applied in health system in Hajj, we couldn't have it from the first go as with all data. We can build it gradually from this year and the next year, and then we can have later a more comprehensive system. So we need to start with a simple available data structure. We will focus on logic and value, not the data volume. We don't need a vast. Actually, more data is better, but we have to be realistic that so we don't need a big data volume. We need a logic and value data, and also we need to try to simulate the missing data. That's a beauty and the power of AI. So we can give them all the available data and then try to read from this data what is the missing data, what is the result that we didn't see, we didn't have it in our hand as a data, but we can predict it in the system. And then we will prioritize use case and the technical complexity. I think we might have end up with one or two case study that we can use it as a proof of concept for our data. And this is going to be one of the next session with my team, inshallah. So in terms of what we looking at the solution to deliver to us, the core output is a real-time governance dashboard. This is very important. It's not very difficult. It depends on the data. It's building the dashboard is really easy. And we can add all the kind of filtration and classification that we need, but we need first to depend on a good source of data. Also, we need to we will provide automated compliance status tracking, at least for some of the compliance checklists, not all of them. Again, as a proof of concept, we need to activate the early warning alert for risk and delays, and at least use some of the predictive one that can be predicted by human, but also we can see how goes with the system itself, and integrated view across multiple health projects, which will help not just us, will help health sector in quick response, decision making and response. And in terms of decision support, we could add the risk scoring for project, so that the data will appear quickly for us when we do it, and also we can have a compliant gap identification. This is going to be very good addition. So the auditors will see the gap in real time, and it can help them to take a decision quickly, and also provide their consultation to the team, and suggest actions and escalate triggers. This is also very important. If we have all this loop, we will have a full automated compliance system. We don't expect that we will have it at the end of hackathon, but we will try to have the proof of concept and have a prototype for that. So the goal is not reporting, it's enabling action. This is one of our goals. So how I can support this? Welcome to my team. We will meet later this week and next week. So we need to look at how we have like structured check-in between us, like a weekly or milestone. So I prepare something that we could share later when after the hackathon, the webinar, and also we will have a feedback on problem definitions. We need to solidate the problem definition. It's my take, but I need to take as a team member to do more investigation, to put more insightful from yourself and from your experience to the problem definition. And we will work together to refine the models and use case focus. We will try to have a real world context of Hajj health operations. This is our segment, our domains. We'll not go beyond this. If we can do it as we wanted, as we expected, as we planning, it will be very good outcome. We need to focus on the governance and compliance as a best practice, and also align with the BMO and digital transformation framework. So we need to have our domains fixed, health care operations in Hajj, particularly the governance and compliance issues, and within PMO and digital transformation frameworks. We will open for question and answer later in today and in the last in last slides, and we will have inshallah iterative feedback loops between us, and hopefully we will have a guidance and simplified and focused solutions, not just from me, from you as my team, and also from other mentor and also other expertise in the field. We will try to evaluate the results, the solutions by align with the criteria, judging criteria that is already established in the hackathon. We will focus on the impact, visibility, and clarity of the problem and solutions. And also we will support in storytelling and presentation later when we present our work for the judges and the audience. Finally, the expected deliverables will be the defining problems, the problem statement, or the final definition of problem statement. Also, we will have the AI solution concept, like architectures and workflow. We have to have it in clear and a correct way. We will try to produce a prototype, including dashboard, models, and simulation, and we will present it all in a very value and impact manner. This is one of our milestones. This webinar, we will start building the phase, and we will check again many times up to the midpoint check-in, and we will submit on the deadline the final solution. And on the day of demonstration and judging, we will present and give the evaluation of the output. So for all the participants with me, use this webinar as a clearly defined your healthcare governance problem within the Hajj context. And also we need to team up and focus early and try to work within a schedule toward the end of the submission time. Thank you very much for coming today. And if you have any questions about the problem, its clarification, clarity, the stakeholders, the pain point, or about the solutions, please ask, and we'll try to answer it today, inshallah. Thank you very much.
Thank you, Dr. Jehad, for this insightful session and for sharing your valuable perspectives. Now we will open the floor for question. Please, if you have any question, write it up in the chat or raise your hand. Now we have one question from Majid. He is asking, did you integrate the AI system with the GIS? If so, what platform did you use for that? Dr. Jihad?
Yes, sorry, it was mute and my screen freeze. No, we didn't. Actually, as I mentioned, I didn't start yet. We didn't start. This is one of the information and data that we need to look at it. So we need to have the location clear that for any mobile clinic and temporary hospitals in Hajj area. So we need, yeah, this is one of the data that we need to connect it to, and we will investigate how we can connect it. It's as a matter of fact, this is one of the easier way to do it. The problem here is the data, the actual data coming from hospital, but the GIS, yes, it has to be one of the data that help also like in risk detection and it support also the solutions and the decision. So we need to know the location of each places that we try to develop their compliance and governance. So it will be there.
Thank you, Dr. Jihad. Mr. Majid, he's asking, are we solving a real operational pain point, or is it a problem too general?
No, it's a real problem. There's a academic publication on the problem of compliance in health sector on Hajj. It's recently become an issue because the people now learning how to use governance and compliance in a more automated way, and they identified some pain point in terms of decision making, risk detection, and also real time compliance check. So this is real problem with the academic publication from last 2 years.
Thank you, Dr. Jihad. I believe we reached to our end of this session. Thank you, everyone, for your participation and engagement. Special thank again to you, Dr. Jihad, for this valuable session. We appreciate your time and thank you.
Thank you very much for giving me this time and the opportunity. Thanks for all the attendance and looking forward to work with all of you, inshallah. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.